Okay, we want to give you all just a minute to get set up. I think there's a little bit of room over here.
Oh, yeah.
Okay. All right, so we want to thank you all for coming this afternoon and taking time to be with us as we share some thoughts with you. As first, I'd like to ask Commissioner Bender, our Vice Chairman of Escambia County, to come up and say a few words.
Good morning. Thank you, Janice. Thank you all for being here today. And of course, I want to recognize everyone watching, all of our Escambia County citizens and people in the Northwest Panhandle of Florida. We ask you to join us today to discuss the Safer at Home executive order issued by Governor DeSantis yesterday. The Safer at Home order goes into effect at 12:01 a.m. Friday, April 3rd, and expires on Monday, April 30th, 2020, unless extended by subsequent order. What this means is that residents should stay home so they adhere to social distancing unless they need to take care of essential activities. It's safer at home, especially for senior citizens and individuals with a significant underlying medical condition, such as chronic lung disease, moderate to severe asthma, serious heart conditions, immune compromised status, cancer, diabetes, severe obesity, renal failure, and liver disease, to limit the risk of exposure to COVID-19. What it does mean, though, is that residents can still grocery shop, fuel their vehicle, exercise, reminding that there's that 6-foot distance that we're asking people to keep from someone else, and less than 10 people, walk, bike, hike, fish, hunt, run, swim. You can go to the bank, go to the pharmacy, vet, or go to the doctor if Teladoc is not available. If you are going to get a COVID-19 screening test, please remember to call Ascension Sacred Heart pre-screening number, and that number is 850-746-2684. I'll give it one more time. It's the Ascension Sacred Heart pre-screening number at 850-746-2684. If you have symptoms of fever, dry cough, or shortness of breath, and they'll ask you to describe your symptoms and see if you need to come in for a test. You can attend religious services conducted in churches, synagogues, and houses of worship. There are also, remember that many of these services are being streamed online for you to participate in. You can take care of pets, care for or assist a loved one or friend, order delivery or get carry-out curbside service from home. And then, of course, the order does encourage people to work from home. The U.S. Department of Homeland Security has a guide to determine essential critical workforce, and most of the function of Escambia County fall within that. So we are still here to assist our residents of Escambia County, and especially our public safety who's responding to a call right now. As I said, our employees will continue to work for you. We are committed to providing essential services to our residents, but public health is our top priority. The safety and the health and well-being of our citizens is our top priority, and that's why some of the actions that the county's taken, and of course what the governor is putting in place is to for your safety and to help prevent the further spread of the virus. Of course, I want to remind residents that tonight we do have a board meeting with the public forum starting at 4:30 and the agenda at 5:30. You can, of course, watch that online. Just a real few quick other comments is that we as Americans, we like to not be pushed down by anything. We like to try to respond as quickly as we can, and we're all trying to do that now. I think the issue is we're all used to hurricanes. The problem is we don't know if this hurricane has hit yet, if it's passed, but I do know that our health leaders and officials are meteorologists in this scenario, and they're telling us that we're not out of that cone of uncertainty or out of the danger area with this virus. So, we need to think of them during this. It's I know a lot of us may think, I'm younger, it won't affect me, I don't have any of these underlying health conditions, but you can still get it even if you don't have those. So think of what it's doing to our healthcare system. Of course, the thing we're concerned with is having the resources available in our hospitals to take care of those that need our help. But it's also a large strain on those that are serving these patients. It's a lot on our doctors and nurses, and so we're also trying to do this for them. And of course, your cooperation is needed in this. I just gave you a long list of things that you can do, but it doesn't mean that you have to go do them. To think of doing your part during this is staying at home and only going out when ultimately necessary. But it is things that you can do to go grocery shopping and things like that. And to talk a little bit more about this, I'd like to ask Sheriff Morgan to come up, please.
Well, good morning, everyone. While we strive in public office, both elected officials and appointed officials, to practice as much clarity as possible, unfortunately, sometimes we don't always hit the mark. And I think yesterday was probably a prime example of that. This morning was honored with Mayor Robinson, who will be speaking after me, to be on a conference call with Senator Scott. That call also included our healthcare systems here in Escambia County. Baptist and Sacred Heart, the CEOs and the presidents were there with that. While again, talking about the tremendous amount of effort that we've put forth to date and where we need to go with this. Now, all of that seems to kind of be swept to the wayside with one bad messaging. And I want to assure everybody that's what occurred yesterday. And that's all that it is bad messaging. If you're wondering why the sheriff's got his hands in his pocket, I'm trying to keep from touching the podium. So I'm trying to practice the things that we tell you that you should practice. So in that bad messaging, our public information officers, both at the city and the county and the sheriff's office, got together and said, we need to come before the public and talk a little bit about this to reassure everyone that basically nothing has changed. What the governor did yesterday was he issued a warning for those, again, who are the most high risk in our community, those that are 65 and older specifically, and it was a plea asking them to please follow the advice of our medical professionals. Limit your outside contact. It was not a lockdown order. Okay? It was never meant to be construed as you now must stay in your home 24/7 and hopefully someone will come and take care of you, and if they don't, you're in real trouble. That was not the message at all. And so what we're doing now is we're going through that list, as Commissioner Bender just read to you, which can also be amended, by the way, both at the state today or locally when your county commissioner meets and says, are these the standards that we feel need to be continued to be implemented in our community? Why? Because, as a couple of commissioners have pointed out, we're not New York City. We don't have the density of population that they have there. I mean, to me, it's mind-boggling to think that I think they have 67 to 69,000 people per square mile. Isn't that an astounding number? Well, of course, any pandemic or any virus is going to run rampant through a community that's stacked on top of each other because we have no spacing or distance to give us any sort of protection. So what our medical community has asked us to do is to practice these things that they have set forth. Social distancing, keeping the public beaches closed, limiting the time that you are out amongst the community, good procedures in hand washing, etc. Dr. Lanza will speak specifically to that in a moment. And folks, we're going to be okay. We're going to be all right. We're going to get through this thing together. That's why Chief Simmons and I have made billboards, at our expense to put up around our community to let you know that we are at the tiller. What's a tiller? It's how you steer a sailboat. And so we're going to make sure that we get this ship through the reefs and shoals because we know where they are. And we're going to make sure that our community comes out better on the other side than we entered. The way we do that is to communicate with each other. Listen to the folks that are professionals. I have full faith and confidence in Baptist Hospital, in Sacred Heart Hospital, in West Florida Hospital. I have full faith and confidence in Dr. Lanza. These folks are putting in tremendous hours to keep you updated with the best information that they have. They're having to overcome some testing problems, but you know what? We're going to get there too. We're not going to stop your car to see how old you are. We're not going to stop your car to say, why are you out tonight? Where are you going? You're going to work. You hear the cars and everybody right now during this press conference. Folks, life goes on as usual. We just want you to be cautious, to take responsibility for your health and the health of your family. That's all we're trying to do. You are safe. You will be safe if you follow these procedures. Honored to be the sheriff of Escambia County. If you have any issues, please give us a call. Don't be the rumor monger in our community that gets on Facebook and starts pushing the word out there that you can't go to work tomorrow because we're in a lockdown or that there's a curfew. There is no curfew in Escambia County. Let me repeat that. There is no curfew in Escambia County. Verify your facts before you start spreading rumors. And with that, it's my honor to introduce the Mayor of Pensacola, Mayor Grover Robinson. Mayor.
Sheriff and Commissioners, thank you for inviting us to be a part of this today. I think most of what we're here today to do is you see us standing here together. We are 6 feet apart, but we are standing together in support of what we're doing and trying to convey a consistent message. As the sheriff said, I was on the call with Senator Rex Scott right beforehand. We had a good discussion about things that are happening here in Northwest Florida. And one of the things that we talked about is that people in Northwest Florida understand disasters and understand the need to comply. Again, the things that have been asked, if you are in certain age groups or if you have certain conditions, that you comply with this. And again, just in general operation, if you have certain things happening in your life, that you comply with this. This is similar to a hurricane evacuation order in some ways, that we expect your compliance. We're not going to be there to arrest anyone, but we certainly have the same concept. We are asking for your voluntary compliance, and that's what makes it so great in our community, that we tend to realize and understand and support these directives so that we can all live the best way we can together and return and get focused on recovery after this is over. The main thing we want to do is stop panicking, stop hoarding. These are things that are not productive to all the rest of us that are working together. We will get through this. And I think that is perhaps the message that is most consistent that you'll hear, is to not panic and to continue to work together. We'll need to do that as a community as we get through this. We want you to stop hoarding and go into the grocery store. You can go to the grocery store. This order in no way says that you cannot get out. We want to make sure that there's enough food and supplies for everyone. So we ask that you do your part in this. You can daily shop, but we ask you to get what you and your family need and no more. And we will get through this. Again, also limit yourself to non-essential travel. In essence, every time you get ready to leave your house, ask yourself, is this really essential? That will give you a good opportunity to understand what's going on. If you have to go to work, if you have to go to the grocery store, those are things that are allowed. The issue is you need to ask yourself if what you're doing is essential for you and your family and for this community. Again, this is thinking about not just yourself. This is being bigger than yourself and thinking about the entire community, because the actions you take will impact the entire community. Now, we're going to get through this in the next 30 days, and we're going to be ready to get focused on where we go with restoration and recovery after that. We can do all that, but the first thing we've got to do is figure out how to contain the virus and continue to work together in that effort. So again, I ask for your patience and your compliance with this order and working together, but understanding and not panicking that you can go get the essentials done for you and your family and be able to take care of yourself. That's what we are essentially trying to be here together to discuss. And at this point, I would like to welcome Superintendent Malcolm Thomas.
Thank you, Mayor. The school district's had a very productive week this week. I want to give a shout out to all of the teachers and school staff for all of your hard work this week to try to do something we've never tried to do before, and that is to teach 40,000 students that are not sitting inside a classroom. That's been a challenge for our teachers. They've had to learn new tools, new strategies that they can use to employ with their students. It's been a challenge for some of our parents to learn how to log on and to act like their student act sometimes when they're in the classroom. But I want to thank them all for their cooperative spirit. We have made so much progress this week. We are completing today the distribution of Chromebooks to students in grades K through 2. Those are students that typically we did not allow to take a Chromebook home, but we're providing those so that those students will have online access. As we've said in the past, there are students in our community that do not have internet connectivity. If we're unable to find a solution for that, we provide workbooks, textbooks. We can even provide lessons on a flash card that we can put in, a flash drive that we can put into the Chromebook so the student can access that. We have been saying that if you have not been contacted by your child's teacher at this point, you really do need to reach out to the school, because we have tried to make at least one contact with every family. If you've not heard, it's probably because we have the incorrect telephone number or contact information. Today, our schools are at the office from 8 to 3. They'll be able to take your call. Beginning tomorrow, to be compliant with what the governor has asked us to do, and that is to increase the level of remote access for all of our employees, we will not be answering the phone at the school. However, all of the voice machines are activated. There will be employees that are tasked to check those voicemails remotely, frequently through the day. They will send email to the appropriate personnel. They will return your call, and they will get you what you need. Essential personnel that need access to our campuses will work directly with the principal or their immediate supervisor to be able to access the school site. All of our feeding sites that we've established this week, we now have 38 school sites that are used to feed students. Those will continue with the same hours. I believe it's 9 to 12. We will continue to monitor those, and we'll either beef up or consolidate where necessary as we move through the next few days. So I think that the message from the school district is it's a different world, but it's one that seems to be working. I'm just so impressed as I look over the shoulder of some of our teachers in the last few days to see the amount of energy they're putting into the lessons, how they're being creative and innovative. And at the end of the day, that's what's going to carry us through. But remember, remote learning like we're doing now in our instructional continuity plan, that was never intended to replace a classroom. I don't believe you can replace that experience when you sit in a room face to face. But we're trying to do the best we can to protect our students, our employees, and our community at this time of crisis with this virus. So be patient with us. We're going to be flexible with you. We're going to be as compassionate as we can. And I think the final item that I probably need to speak to that is on the mind of every student that is in the 12th grade. Everybody's worried about graduation and commencement exercises being canceled. At this point, it doesn't look like it's very hopeful that we would hold a commencement at the end of May. But I have said since the beginning, we're going to do whatever we can do to make sure a graduation ceremony is held. I believe we could wait as late as July and still have the majority of our students still in the community. If that were the case and we were allowed to assemble large groups in July, we would go to the Civic Center and we would have a graduation ceremony. Again, I don't know what I don't know. So we're going to hold off on making any decision about that graduation ceremony in terms of the date or the location, how we're going to do it, until we know the facts at that moment. I will tell you this, we will do something to make sure we honor our seniors who've spent their life thus far preparing for that moment where they could walk across a stage in a cap and gown, have a picture taken, and receive a diploma. We know that's important, and we're going to support that in any way that we can. Thank you.
So before we go to questions, I just want to make a couple of more recognitions. We have Commissioner May here, we have Dr. Lanza, we have Eric Gilmore, our emergency manager, and then those that are off camera, we do have Mark Faulkner from Baptist, Don Rudolph from Ascension, Gay Nord from West Florida, and Chandra from Community Health Northwest, and we just really appreciate them. Oh, and Commissioner Underhill, he's been standing so long behind me. He's not invisible, I did see him. But I would also like to just say to you that as a community, I do think if we do continue to work together, we can come out of this stronger. I would also encourage everyone, we did create a graphic that we hope folks can utilize to kind of just, reiterate, here are the things that you can do, but also think about those extra trips before you make an extra trip. We've also been very clear about where our community and our county government actually functions in terms of essential critical functions should we get to a much more stringent point than we currently have. And I would just say, when you start sending people home to work, maybe they're by themselves, maybe they're isolated. Don't let your neighbors be isolated. Find ways to communicate with them. Find ways to bring people together at a proper distance, but don't leave people alone. People are concerned, but we don't want them to be concerned by themselves. That can create other issues and other problems down the road. So do whatever you can to continue to connect, whether it be electronically or from the yard next door or from the street, okay? So please don't let your neighbors be alone. Don't let the senior citizens be alone or anyone else that's had to go home and work from home remotely. So with that, I would open it up to questions.
We've got a list of the essential businesses. Are any businesses closed? The Miami-Dade order, they had a press release that actually closed businesses. Are any businesses going to be closed because of this order?
The county commission has not taken specific action to close businesses, and I would be more than happy for the mayor to speak. We will be entertaining this evening an order specifically related to bingo parlors, because I do think there may need to be some clarification from the county commission about that particular entity.
Rick, I think at this particular time, we're looking for compliance, and we've asked for those kind of things within businesses. So seeing that tonight is when the order goes into effect, it's still a little bit early for us to see what's there. But I think we've tried to be very clear about those things that are essential and non-essential, and that we begin to figure out what those things those are. I think you see what was in the Miami-Dade. We hope people have had a chance to read that and see the different businesses that are listed. I know we're trying to, I see Casey put that out there and let people know what is going to be available and not from that standpoint. But we're going to be looking to compliance, and we're asking everybody to try to figure out how to comply. Some people may still be able to do their business from their home. We have no problem with that. And I think we're all learning how to do this. It took the city, a week or so to figure out how to do it, but we figured out how to significantly take our toll down from our individual buildings. Certainly City Hall is significantly fewer in staff than what we have been. But I think that's what we're asking people to do. And I think as people get used to this, we'll get better over time. But I think it's a little bit too early for us to say what's going to happen, seeing that the order doesn't go into effect till tomorrow. So I think people through the weekend will figure out what they need to do.
So unlike closing bars and restaurants and gyms, there is no, it's going to be voluntary for all other businesses at this moment?
Right now, we're asking people to figure out how to comply within it, and I think we'll come out of the week and we'll understand a little bit better where we are.
We're aware that the ECAT bus drivers sent a letter to the county asking if fares could possibly be suspended so that they wouldn't have to, make those exchanges, and then also add statement writers and then to the back of the buses. Has the county addressed that yet?
We've not addressed that specific request yet, but I have been in contact with the director. Every morning we do have a conversation about status, and she is actually on the board of the Florida Transportation Association, and so she has been monitoring those issues statewide. So I would say that I think she was looking at implementing a policy on Monday, but I will let her provide that report to me this afternoon. But she has been monitoring that for weeks.
And then another question, in other situations where the EOC has activated, they've had daily briefings or weekly briefings. Here we've had 2 so far in the past 15 days. What is the difference between this situation in regards to the amount of briefings that we've been holding?
I'd be more than happy for Eric to come and give a little bit more clarification, but just to let you know, every day we are trying to provide two daily reports to you all that are providing the updates from all of our partners from the Joint Information Center electronically. And so if there's information that you're not getting that you'd like us to provide, we'd be more than happy to provide that. But I think that we've been trying to do that mostly electronically so that folks can all get the same information at the same time. But I'd be more than happy for Eric to respond as well.
She nailed it right there. We're trying to minimize people in the EOC. This is a pandemic, unlike a hurricane or a natural disasters where you can actually see the progress out in the community. Well, we've got heavy equipment, we got manpower, we got things moving. In this situation, you really don't see it out there. So we try to get that out twice a day to you guys. If it is something you're not seeing or getting that you need, please let us know. We'll be happy to do that.
So we lose the opportunity for the press to ask questions. It's a one-sided communication. In today's world, we have Zoom. Could we do a press conference using Zoom?
Okay, so
You want to hit that?
yeah, I will actually. I will just say, let's use a different vendor title, because we were notified today from our IT that Zoom actually does have a very serious hacking problem. So we may try and come up with a different way to do that. We use Teams. A GoFundMe. Potentially, we'll see how much it costs to implement a new platform. But yes, I appreciate the question, particularly related to that. And so we have been looking. We've been using Teams internally. I meet at 8:30 in the morning with our directors, and we do it through the Teams app. And we're able to either face video or also do it, voice. And we also have implemented the chat. So we're actually becoming more technologically savvy here at the county. And our directors are finding, I think, a really good way to communicate with each other. And we're actually encouraging them to implement that as they communicate with their own employees as they start maybe working more remotely. Yes, sir.
County functions that require public hearings such as future land use and rezonings, how is the county accommodating public participation?
Okay, so first of all, a couple of the things that we had not previously canceled were like the lien issues related to special magistrate hearings. So we were having folks come to the central office complex and participate in those. We were making sure that we were monitoring distancing. We were having a very large room, and then we were also still having our development review meetings, because those are typically less than 10 people, and we can set up in a very large operating space. So those are the two entities particularly that we are still operating from. The other issue that we're dealing with is our board meeting this evening. We have provided a public input form online for people to provide input electronically, and we are strongly encouraging people to please participate electronically, although we are not precluding folks this evening from participating. It is before midnight. But I would say, for the most part, we are trying to provide as many technological opportunities as possible. And it looks like the mayor would like to respond to that as well.
Yes. At the city, for the most part, we have stopped meetings for April. We have kept them going forward, and we've taken this time to learn to adjust, just like everybody else is. We've already made the decision, because of the governor's decision, about how we can conduct meetings. We had a meeting already without audience, and we're going to have one in April. We are trying to do as much as we can without. But there are certain items that just simply need council, need public vetting. But again, on all of those, we've tried to make it available where people could call in, or trying to figure out how to get more comments in as well on what we're doing online. Toward that end, we will continue to do Monday press conferences at the city, but we are also we realize at this particular time that individuals, and things are so dynamic that we've had the opportunity to go on and do it from our office, and we're trying to get better at understanding. If there's a question beforehand we'll try to take it. We didn't figure out yesterday that we had comments coming in. We figured that out this time, so we know what to do better, and we'll do that. But we would ask for your patience. Like you, we are learning in this. We're in a learning curve. All of us are. So if we make a mistake, we're going to learn from it. We're going to be better the next time we do it. And that's one of the things Casey's doing right now with us, and she's got us well prepared. And I would just say, have some patience with us. But we are learning just like you, and we're trying to mold our activities in response so that we can get the information out to you and do it in a way that you've got it. And if you have problems, please tell us. We are working to amend things as we can. I think the biggest thing is that we continue to have that patience and understanding with each other. If we do that, we're going to get through this, and we're going to get through it in the right way for us to make sure that all of the public is involved in all these decisions.
Sheriff, this question is for you. Have you had any communication with the governor's office as far as how this is going to be enforced? The sheriff in Santa Rosa County had a little bit different message last night than you did, talking about parks, people shouldn't go out to bars, boat ramp closures. What have you heard? That's a little confusing.
Well, the governor has, while he's put out some guidelines, he's also given a tremendous amount of latitude to the local officials. And so those are things that I've made very clear that, I'm a support element in this, and I'm on the enforcement end if something can be enforced. But I depend upon the mayor, because the city obviously is a part of the county, and also our Board of County Commissioners to filter through that and either go through the appropriate ordinance process to pass an ordinance and those things that in fact are enforceable. So you're going to see a variance from county to county to county on how they enact this. And also I will tell you, as sheriffs, we have a latitude in a lot of that too. So, but you got to remember, I'm going to share with you one of my favorite Churchill quotes here, and this is kind of what we're grappling with. Churchill was accredited with saying, you know, Americans can always be depended upon to do the right thing after they've exhausted all other possibilities. And so that's a little bit of what we're going through here. You know, we've got all these different moving parts, and we're trying to find the appropriate path, you know, to victory over this virus. And so, you know, work with us. By the way, do you know how important you are in this? Folks, you got to be on this. The press is a partner with this, and every major issue we've had in Escambia County, it's incumbent upon you to get the story and get it right, okay, and to get it out to people. Because while we have social media platforms and we've got more of a reach than we've ever had in the history of the United States, people still depend upon you. And a very important segment of our community doesn't use Facebook. They don't blog. They don't do all of these things, and that's a large block of people. A lot of them are shut-ins. So if you're not conveying the accurate information, we're in real trouble. So we need your help in this. We need you to step up to the plate and do what we know you do and you can do best. Okay.
Sheriff, could you give us an update on the COVID-19 virus in your agency? I know you had a positive this past week.
We did. We've had one positive. We're very fortunate, as I've shared with many of you, and law enforcement throughout the state have shared this with the governor and with Senator Scott this morning. We're concerned about losing the war of attrition if we don't continue to keep our arms around this. This is why when your medical community, your medical professionals are telling you, you know, get the PPE, do the social distancing, do all those things, I will tell you, I'm in a business that I can't do that always. Now, I can do it in some instances, and so we're doing that. I believe because we've done that, we've had one positive test, and this was an individual, by the way, that had contact with somebody who had been out of state, you know, in a hotspot area, and so, you know, they caught the virus. We went up to a high of, I think, with 30, actually topped out at 33 one day, and then we hovered at 31. Today, Rick, we're down to 21. It'd be 22 counting the one that tested positive. So they're coming off of the self-quarantine, and now they're returning to duty. So again, but we're, you know, if there's something that we worry every day, it's that. Because again, so much of that is out of our control. If an arrest requires that you go hands-on, which what arrest doesn't? You know, we're not to the point yet in our society where we can say, thank you, sir, would you handcuff yourself for me? And, you know, I've got a seat for you in the back of the vehicle here. So, anything else?
Yes, the Pensacola Police Department is now starting to assist the Florida Highway Patrol with the checkpoint on I-10.
Right.
Has, I think here, the Department of Transportation reached out to the Sheriff's Office for any assistance there?
That's been left up to sheriffs individually. What we're doing right now is reassessing our manpower situation because of the school system. I've got some SROs that may be available, but right now, because of the problems that we were having, I want to remind everybody we were partnering with the PPD and the local authorities, et cetera, you know, to do some major pushes in some, you know, some crime that we had in our community that the mayor and the PPD led off several months prior. And during that time, you know, we didn't have enough people to cover the board. So now, in those continuing operations, we're transferring some people to be on that. So if we have people, we're assessing it right now to help that. But, you know, to me, that's kind of a low-level operation. That's a stop, send them to the medical people. They do a swab, they move on. So if we have a more critical need for our law enforcement officers in Escambia County, you know, it's incumbent upon me to station them there, and that's exactly what I'll do.
Along that end, I thought Sheriff Morgan made a great comment on our call with Senator Scott. He said crime hasn't stopped. So again, we depend on both the Sheriff's Department and the PPD. And I think we're very cognizant of what's happening with healthcare workers and why we're trying to flatten the curve and the importance of healthcare workers. The same thing happens for first responders, both your police, your fire department, and your sheriff's deputies. We can't afford to get to a position, much like they're seeing in New York, where they can't even field a force to take care of normal needs. So this is vitally important in both agencies, and we are continuing to monitor that as well. Rick, I would say we were up as high as 34 at the city. We're down to now 18 that are out. We have had a couple of people. I think we had a fireman that traveled. He never came back. He ended up testing positive. So, I mean, we've been able to keep them out on quarantine. That has helped us not spread within the department. But we have a number of people right now who are out of the city. And I believe we also have one police officer who hasn't been tested, but it took him so long to get back from his place trying to get back to the United States. We simply told him that he was on quarantine until he could come out of that. We were just going to assume that he had the virus, so he is at home quarantining himself. So at this particular time, that's kind of where we are as well, trying to work through that, and it is a part of it. But fortunately, the people who are most at risk, the first responders, we have very little. We still have a lot of capacity at this particular time.
Before you leave, one question. Do you anticipate any layoffs of city workers this month?
We sent out something the very first week, and we said we want you to understand your job is safe. We may ask you to do certain different things, and we may ask you to work from different locations. But at this particular time, everything we have within the budget is there. We are looking at next year's budget, and we understand there are some things that we'll have to look at. But at this particular time, absolutely, everyone that's there, our most biggest concern is making sure that people have jobs, can take care of their family. We're trying to do that. We understand that there are individuals in the private sector that have lost that opportunity. We hope they will be able to participate in the in the CARES Act and the things there for individual workers, and we hope to get them back up and running as soon as possible. But at this time, we've made a commitment absolutely within ourselves internally that we are going to keep all of our individuals, and we sent that message out to our employees.
Janice, the same question, please.
Yeah, I mean, I would say very similar to what the mayor has said. One of the things that we've been doing is we've been reiterating every single week with our directors what functions the county has to absolutely maintain. And if there are some functions that are maybe less essential, then we will be using those folks as manpower for other positions. So we have already done that. We have a very strong manpower pool. I don't know if you are able to be inside, but we do have some ECAT workers that have been working here on a daily basis and have been helping out with our food services. They've been helping out with taking the temperature when you go in the building, and they've also been helping at our staging area for supplies. So I would say this, the county is doing everything they can to keep from having to furlough employees. What I cannot say is that there will be absolutely no furloughs, because I do think that it depends on how long this particular enemy continues to attack us as a community. Our number one goal is to not have to furlough any employees.
So would furlough be unpaid?
It would be. It would be laid off.
It could possibly happen this month.
I do not know that answer, because I think we would need to see how long this particular situation lasts.
That's a different answer than the mayor.
Okay. Yes, sir.
Are you hearing anything about the government workers or citizens having difficulty with the state's DEO unemployment compensation website? It's been crashing. A lot of reports out of Central Florida that people are unable to access it. The president's stimulus bill has created a new category of employees, the part-time contractors who must go there to qualify for the stimulus. We're getting some input from citizens here that they're unable to access the state's website. Has the county communicated with the state regarding that challenge?
I have not had that particularly presented to us, so I will check with our Citizens Information Center, and I've not had any of the commissioners specifically mention it. I do know that they are fielding lots of phone calls every day from their citizens, so I'll let the mayor respond.
We absolutely have gotten calls about that and discussions and talked with somebody. In fact, my neighbor, I saw him last night, and he was pulling his hair out because trying to figure out how to apply for this. Not so much for him, but his employees. He has a small business. I think that's what they're very concerned about at this particular time, and I know I continue to hear that. It is not something we're particularly over, but we're trying to advocate for that, and we will continue to do that. I can't say that I understand the reasons or what's happening, because it's not a city or a county function, but we are getting that, and we are trying to advocate much the same way that we're advocating for our hospitals on PPE and stuff that they still need. We're absolutely here advocating for our citizens what they can do, and again how that works for them.
Obviously, as one of the 5 county commissioners, I can only speak for the phone calls and contact that the citizens have made with my office. And I can tell you, John, yes, absolutely. That is what people are calling my office about. They are deeply concerned about it, and they have been since the first day. You have to understand that many of our hospitality workers, they use their check to pay their bills, and they use their tips every day to pay for groceries and necessities. So this isn't a problem 2 weeks from now. This is a problem they have been suffering with for 2 weeks. There are roughly 40 people on this patio right now, and I'd venture to say that maybe only 1 or 2 of us may have actually be suffering deep financial concerns. But if we put together 40 people in Brownsville, Mayfair, Warrington, Montclair, you would find that more than half of them probably are suffering deeply financially, unable to fend for their families, unable to pay for their families. And I know that we have a lot of projects, a lot of things coming down the pipes. We're expecting to have a lot of money from the federal government. The last great crisis we had here was the BP oil spill. Raise your hand if you've gotten all the money you were promised from the BP oil spill 10 years later. Okay? We don't have that kind of time to wait. We need to make certain that we are only putting out of work those Escambians who have to be out of work for the safety of the population. This is a part of the discussion, John, that needs to be a much more part of the discussion. Those of us who make these decisions, those of you who report about it, the people who work for us on taxpayer dollars, they have no trouble feeding their families tonight, but my constituents do. And that's the conversation that we really need to start putting into this, and really start thinking about how do we get Escambians back to work in such a way that does not make the rest of us at greater risk. John, does that answer your question?
It does. Does the chairman of the Board of County Commissioners envision sending a letter to the governor highlighting these issues and asking for ad hoc or emergency responses to help these people?
I can't speak to what the chairman intends to do, but I will tell you that there are commissioners from across the Panhandle who started getting together and talking about ordinances that are more appropriate for the Panhandle than the Miami-Dade model. Now, the sheriff made it very clear that the information we're getting out of New York is informational but not indicative of what will happen here. Informational but not indicative. We do not have to respond here the same way they do there because this is a different environment. The same is true of Miami-Dade. What needs to happen is, and what's starting to happen now, is that commissioners across the Panhandle are getting together and making sure that we have a message that we can put forward to the governor to show him what is right for Escambia County, Bay County, Walton, Okaloosa, and Santa Rosa. And once we start seeing that information get to the governor, keep in mind, this governor has always been a huge supporter of home rule. He recognizes the diversity of Florida, and he recognizes that what's right for Escambia County is not necessarily what's right for Miami-Dade. And as a governor, he has to give us the environment in which we local leaders can lead in a way that's appropriate and best for our citizens. Thank you.
Thank you. Thank you again for coming, so we appreciate it.
We just received some reports from some of our local grocery store chains that they're might be falling short on their own cleaning supplies, especially the wipes to wipe down their own cart. So one question that we had is what is the health aspect of using one wipe to clean down multiple carts?
Well, of course, that's a bit problematic. I would encourage them to find any kind of cleaning supply, even soap and water, to clean down whatever it is, the solid surfaces that they have. You don't need to have a specific wipe. It's really more the mechanical action of it, of removing contaminants, but just plain soap and water and rinsing afterwards, that would be another way of doing it.
And then just one more question for you. So after a person is diagnosed with COVID-19, what really should be their next step? When should they decide that I need to go to the hospital?
Well, presumably they have talked with their healthcare provider. Their healthcare provider, based on the criteria that we have for screening, has told them to get screened. And then, excuse me, my allergies. It's my allergies.
There is water.
There's water. Okay. I knew this was going to happen. It's just this, all the pollen out here. But 85 to 90% of individuals will either have no symptoms or will have minimal symptoms, cold-like symptoms. There is that 10 to 15% that will have more significant symptoms. So if they've been in contact with a healthcare provider, they have a positive COVID, they're home, they're self-isolating, they're trying to stay away from family members, obviously trying not to go outside unless it's absolutely, absolutely essential. And I don't recommend going outside at all, but if it's essential, follow the governor's executive order that came out yesterday. But if they do feel that the symptomatic treatment that they're helping themselves or their family's helping with, they feel like they're getting worse, then they need to call the healthcare provider and follow that individual's advice. Now, some of the classic signs of COVID is shortness of breath, high fever. If you're in that kind of a situation, that's when you call EMS. We have 4 great healthcare systems in our community. Hope everybody understands that. We have Ascension Sacred Heart. We have Baptist Healthcare. We have West Florida Healthcare. We have our federally qualified health centers in Community Health Northwest Florida. We have 3 drive-through facilities. We have the hospitals themselves performing. We have a lot that other communities do not have. What we need to do right now is to follow the governor's executive order, which is it is safer to be home unless you absolutely have to be out for job or other essential activities that are outlined in the executive order. So my message is follow the governor's executive order and it is safer to stay home.
Dr. Lanza, we've only tested about 1% of our population. Is there any talk about expanding testing beyond that 1% so we can get more people tested?
Yes, as the supplies are available, as more testing sites potentially will open up, we will provide, there will be more testing available. Yes, there's 3,000 plus tests that have been done. I should say specimen collection that has been done. Yeah, and there is talk of in-office testing, but that's not available right now. But yes, my understanding is that a lot more testing supplies will be available in the near future.
Thank you.
Thank you.
Good job on the, that's good to hear. Good to hear.